Welcome back to the Performance Prescription. Matt, how have you been?
Doing good. Doing good. Really glad to see you again, Jared. Thanks for hosting and welcome, Frank.
Thanks for having me.
So, Matt, I like to ask you usually at the beginning of episodes what you hope to hear out of our interview and our conversation here with Frank. What are you hoping to kind of zero in on?
Yeah. So I met Frank about a year ago at a conference in Dewey Beach, Delaware, and just was intrigued by his story and what he and his team are doing at his hospital. But just, yeah, really looking forward to his insights on his unique role and his unique perspective on what's going on in the healthcare marketing space today.
Fantastic. All right. Well, I'm going to turn it over to you, and we look forward to hearing from you and Frank.
All right. Well, Frank, thanks again. Yeah, like I said, I've quite a few questions, a lot of ground to cover, but could you kind of kick us off just by introducing yourself, what hospital you work for, and what's unique about your role and team?
Yeah, again, thanks for having me. So my name is Frank MacPherson. I've been with ChristianaCare, headquartered in Wilmington, Delaware, serving patients in Delaware, Pennsylvania, New Jersey, and Maryland. I've been with the organization about almost 9 years, but 8.5 is probably more accurate. And my role has changed over time, but for the last 5 or so years, really been focused on digital consumer and patient engagement. The short term or the more common term you may hear is digital marketing, but because we have separated things like organic social media from, in another role, it's much more about kind of marketing operations, leveraging our MarTech stack. And like I said, I and my team focus heavily on direct to consumer, kind of that one-to-one conversation as much as we can make that happen.
So tell us a little bit more about what you've separated across the different teams and a little reasoning, why the separation.
Yeah, the why is the trickiest question. There's a bit of a legacy structure for our team, to be perfectly transparent, where things like website operations, the maintenance, CMS, those are all managed by my colleagues, but not something that I and my team directly own. Same thing, as I said, for organic social media. So really in the marketing space and in my marketing kind of digital CRM sub team, as I said, we leverage the MarTech stack as much as possible. So that includes platforms like Salesforce Health Cloud and Marketing Cloud. We use Cvent, Chat Meter. Kairos is our Find a Doc platform. There's a variety of others. Certainly something that is very important for my team and for the organization is paid search and our ability to be front and center when patients and consumers are looking for care or looking to learn about things that they're dealing with in the health and wellness space. So there's probably a bit more detail and nuance I can get into, but that's the high level. And as I said, those decisions they predated me. And, as I'm sure any org will do, is we constantly look for ways to integrate with those operations, make things run smoothly. So there's quite a bit of overlap, as you can imagine.
Everyone's talking, experimenting, exploring AI right now. And we usually kind of save this question for the end, but with where you sit as far as MarTech goes, how is AI impacting you and your team, or is it, or what are your thoughts?
Yeah, I have to separate my personal feelings about AI from my professional feelings about it, to be honest with you. Probably another time in another podcast. But the short answer is, yeah, it's here. It's been here for some time. There's some things the royal we know about it and how it's affecting consumer behavior. Certainly, you can't talk about digital marketing without talking about LLMs and, the way that they have changed consumer behavior for all kinds of intersectional demographics. Everything you hear in kind of the marketing consumer engagement space is about zero-click activity, and not just in GPT, but also in Google and more traditional search platforms where users are not landing on your owned media. They're staying in these closed ecosystems because that's what Google wants. That's what GPT wants. That's what the others want, is they want to keep a hold of those users' attention. So we have to handle that and manage it and learn about it. So it's very much a build the airplane while it's already in the air mentality, where, you learn a little bit more. SEO has been important for marketing organizations for decades, but now we have to complement that with generative optimization and how we are represented in some of these engines. There's a handful of tools out there. There's also human capital and resources and knowledge that we try to take advantage of. And then it's also kind of like when the world went from yellow pages to Google is we don't know what we don't know. And I think in some ways we have to be okay with that.
Yeah. And I like what you said as far as building the airplane while it's flying mentality, because it's a very much AI is here, AI is evolving, and we don't know what's going to look like tomorrow, but we better be ready.
Yeah, the wrinkle, of course, that's relatively new is ads in AI, right? So GPT just started to roll that out, and it was inevitable. There's nothing that exists on the internet that won't have advertising associated with it to some degree. And so for not just us, but for, I'm sure, any brand, it's trying to understand how that fits, how it will disrupt what users have become accustomed to in those platforms, how you can leverage your organic content and content marketing and then pair that in some way, shape, or form with whatever the paid ecosystem looks like. So very much similar to, organic social and paid social, organic search and paid search. It's the same kind of feeling, muscle memory. It's just a different platform.
And obviously that's going to change dramatically over the next couple of years. Are there any recent projects or things your team has done that you're proud of or like to showcase?
Yeah, it's kind of, if we were in a different industry, I probably wouldn't get away with calling this a win in terms of pride, but we launched within the last year or so a review solicitation campaign using, appointment data and other data and Salesforce to ask people to leave us reviews on Google. Again, not a game changer. This is something that brands have been doing for years. But just like anything in the healthcare space, we're a little behind. But we have seen, as you can probably guess, a tremendous uptick in our reputation publicly. We've always had a strong reputation. If you think about HCAHPS and patient experience scores, the surveys that you get after you have your encounter, but that's a closed environment, and that's specific to your provider and care delivery. And that really never translated to what we would see as a brand in our Google ratings. And you can probably guess why. Human nature is if you're upset, you're going to look for an avenue to express your frustration or your anger. And that's the easiest one to find. And so that's where we would see a delta between our kind of public Google reputation and what we would see in patient experience scores. So that was the problem we were trying to solve, is those Google ratings didn't really reflect the strength of our brand and our reputation. So we started small, but then scaled. Within the last year, we've seen better than 1,000% of, comparing year over year, a more than 1,000% increase in the number of 5-star reviews. Now that tells you two things. One, our reputation is really strong. Two, we weren't getting a lot of reviews before. It's easy to get 1,000% more than very few. But more importantly, we saw an average rating go from a 2.7 to a 4.5 almost overnight because we were asking people to tell us what they think about us. So anyway, this is not a new idea, but it was a new exercise for us. It took some doing to get it done, to make sure we were asking the appropriate patients to review the appropriate modalities. And yeah, we like what we see.
Did you set up any systems to do follow-ups if you got negative reviews?
Yes. So we didn't gatekeep. We weren't trying to find only happy patients. We were looking for feedback from everyone. And we did, in that campaign, are still doing that campaign, invite people to send us feedback directly if they had a concern or question or follow-up. So it really was a secondary call to action. In the first case, it's, hey, leave us a review. Here's a direct link to that Google listing, or language around, if you have questions, if you have concerns, send us feedback. And that just opens up a simple email that comes to us. And then depending on the nature of that message, it can go to the provider or the practice and go to our patient relations team. So there's lots of avenues to make sure that people feel heard. And in some cases, continue the care conversation they have with the right people. I'm not a provider. I'm not a person who delivers care, but I can get in touch with those people in a more direct way.
Yeah. And actually, that's a really good point, Frank, that, if I have a bad experience at my barber shop, it's not a big deal if I don't go back. It might be to the barber, but as far as to my life, it's not a big deal. But if people are dropping out of care because they're not feeling heard or not having a good experience, that can have serious downstream impact. So it's great that you're taking it seriously.
And I don't want to overstate it. There are instances where we can take real operational feedback and share it internally. In most cases, these are things that the organization is already working on. But in some cases, hearing it straight from the source, from the actual patients, these are things that might not come up in a traditional patient experience survey, but may come up when you kind of give that prompt.
What was your experience engaging with, across departments, and was that a, positive impact for the overall project?
Yeah, this campaign and quite a few of ours, it stretches beyond marketing. In most cases, there's a combination of our medical group, our providers and practices, IT, and that was the case here, where it was a triangulation of data and governance to make sure we were again identifying the right patients, asking them the right questions. If we're going to use appointment data, we have to be sensitive about that, and starting with primary care in particular, but then we moved into OBGYN, women's health. And so there are certain experiences that those patients might go through that, hey, it's just not appropriate for us to ask. They may have had a wonderful experience, and we hope that they do every time. But we make those governance conversations of, hey, let's exclude those patients from this kind of campaign, at least for now. And we wouldn't make that kind of decision in a vacuum. That's where we partner with our leadership on the clinical and operational side to better understand those patients and their experience.
I think I'm zeroing in on the path that's led you to where you are now. And it can usually be pretty fun to ask ourselves, which I think a lot of us think about, like what types of things would you share with your younger version of you?
Yeah.
Or just to younger professionals who you do share with them now, like the kind of the common things that you share with them that are usually based on your own experience in your career. I wonder what you would say to either younger professional or younger version of yourself about, like looking back at some of those
Yep.
lessons learned.
I mean, can I tell myself to buy stock in Amazon?
Yes,
It's
absolutely.
probably, yeah, okay. Um, no, it's a good question. This might be counter to what maybe most people say when you ask them that question, but I think it's get really good at one thing. Now, the one thing could be a big thing like content creation, and content takes many forms, right? Video, podcast, blog, print. So when I say get really good at one thing is in marketing in particular, there's so much, the breadth of the avenues and channels that we can leverage to engage with the consumer audience, regardless of industry, is staggering sometimes. So, and I spent a lot of time early in my career as more of a generalist. And so again, this might be personal preference, but if you can get really good at one thing early in your career or even in the undergraduate space, that's going to give you a differentiator as a professional, in my opinion, to say, here's a hard skill that I can bring to your organization, to your team to help you grow. And then you can continue to develop that either in continuing education or in your professional career or some combination therein. But that's probably where I would start if I was talking to my younger professional self, because it took me quite a while to kind of get into this more digitally focused marketing technology space. And I found that it's an area that I enjoy and that I like to think I excel at. So that's, maybe getting to that point a little earlier in my career would have been an interesting wrinkle.
I like that. I think kind of like the counter question to that is how did you get into healthcare marketing, and like why do you stay in healthcare marketing?
Yep. That's a really good question. It's might be a cop out to say, but ChristianaCare as an organization is not like any other organization I've worked for. And I've worked for quite a few. I've worked in the public space. I worked for nonprofits, associations, publicly traded companies. But it's an organization that really lives its values. They aren't just, things that you put on your website or things that you post on the wall. And it's a nonprofit health system. So we're not heads and beds, turn and burn. Let's get everybody in to replace their hips and knees. It's really about the health and wellness of the community. And that affords me a different experience when it comes to marketing and engaging with our community that you wouldn't have in maybe other industries who are more revenue and profit driven. And then, the marketing side of it is the challenges that it comes with. If you talk about trends in healthcare and setting aside the whole AI thing, it's choice, right? There you have, disruptors and blah, 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 all that cliche. But the reality of it is you have really valuable, highly reputable brands coming into the space or existing and expanding into the space. I just read the other day that Costco is offering fertility treatments. Could be an absolute game changer Think about the process that people go through with IVF in terms of the experience and the expense. And if Costco, again, a highly regarded brand, can have some impact on that, that's a good thing because it's helping patients. It's helping people get the care that they need. But it creates challenges for the traditional healthcare provider space and the people like me who are trying to market those providers. So let's call it a challenge, call it an opportunity, but at least it keeps you busy and it keeps you invested and stimulated.
Great insights, Frank. Really appreciate you sharing. And it's interesting, like, as we're talking to healthcare systems and hospitals around the country, I'm hearing that theme on repeat, like battling, not so much, I mean, battling apathy definitely comes up, but it's more on the education side where, I'm talking to hospital marketers and they really care about health outcomes for their greater communities. And how do they how do they help and equip their hospitals and health systems to be a force for good in their communities? So do you have any thoughts on that? Is Christiana doing anything in particular to impact the community at large in a global good sense?
Yes, I have many thoughts. If we were having this conversation 10 years ago, it might be a different kind of a conversation. It's not 10 years ago, it's 2026. So yeah, when you talk about uh, education and misinformation and misperceptions and misconceptions about care and the way care is delivered and why, there's a lot. So yeah, to more directly answer your question, yeah, the ChristianaCare devotes tremendous resources to those efforts. And I am a small part of that. I'll give you an example. One of the things we do by leveraging our MarTech stack is an annual flu vaccine campaign to encourage specifically our primary care patients to make sure they get their flu vaccine and to educate on why it's important to do so every year, who are the higher risk patients with comorbidities or elderly patients, but then the reasons for, the general public. We were doing the same thing with the COVID vaccines, and we had to kind of change our approach this past flu season because of the availability or lack thereof, particularly with the COVID vaccine. And then, the last few years, RSV has kind of come in as a trilogy of respiratory diseases that we try to work with our community on. And you see a corresponding spike in patients coming into our EDs with, issues with flu, with COVID, with RSV. And these are preventable issues through the vaccine. It's not to say that the vaccine, as we all know, is the end all be all. You can get the vaccine and still get sick, but the data and the science behind it and the ability to have a less intense experience with the help of those vaccines is there. And so as marketers, as communicators, as we refer to people at ChristianaCare as caregivers. Everybody you're not an employee, you're a caregiver. As caregivers, that's a conversation that everybody has with whoever they interact with. And, there's just so much information out there that is fighting against us when it comes to things like that. And that is a real, real challenge and something that's probably going to continue for hopefully not get worse, but we'll see.
Well, I appreciate you fighting the good fight. Appreciate what you and your team are doing, to say the least. Any final thoughts from you, Frank?
You asked about younger self question, and there's something that popped into my head. I had really good examples of leaders, my direct managers early in my career. And I don't think I've done so explicitly, but perhaps, subconsciously or implicitly, I've modeled my own approach to being a people leader after those folks. So, I think it's the cliche of you don't quit a job, you quit a boss is not untrue. And the opposite of that is very true, is you might not necessarily stay entirely for the job. You might stay for the relationship and your ability to grow. And I was fortunate to have people who supported my growth and set me up for success. And so that's another thing, early in your career is look for those strong leaders, look to see why they're leaders and not bosses, and kind of pay attention to the little things of why that is the case.
That's a great insight, Frank. Really appreciate that. And it's a good reminder that the younger generation is always watching. So I think for all of us who are further in our careers, what can we do to continue to be good examples and to pour into the next generation?
Bumming me out that you're telling me I'm not part of the younger generation.
You're a little younger than me, Frank, but yeah, I think we're all hitting the second half for sure.
All right. Well, thanks, Frank. Thanks for all the insights here. Thanks, Matt, for guiding us along this journey, and really appreciate everything you shared with us today.
Yeah, thanks for having me. This was great.